So starting with bandhana. Bandhana is explained in Sushruta Samhita in the 18th chapter. That is Vrana Alepana Bandhavidhi Adhyaya. That is the reference. And in that chapter, first it is told about the Vrana Alepana Vidhi. Next, it is told about the Bandha Vidhi. And in the Bandha Vidhi, first Acharya is telling about the Vrana Bandhana Dravyas first. And the shloka is अत ऊर्ध्वं व्रणबन्धनद्रव्याणि उपदेश्यामः तद्यथा क्षौम कार्पास कार्पास आवीक्त दुगुल कौशेय पत्रोर्न चीन पट्ट चर्म अंतर्वल्कल अलाबु शकल लता विदल रज्जु स्थूलफल संतानिका लौहानीति तेषां व्याधिं कालं च अवेक्ष्य उपयोग प्रकरणतश्च येषाम् आदेशः. So first it is told about the materials which can be used for bandhana. And the first material told is kshauma. And kshauma, karpasa, avika, all these are different kinds of wools or means first kshauma it is told like adasi tandubhir vyutam. That is, it is adasi tandu. Next karpasa it is told like karpasa tandu ajita. That is the cotton plant. Next avika it is told urabhraroma vyutam. That is from the sheep. So based on that, different kinds of wool or cotton can be used, or different kinds of cloth used made with these kind of materials it is told. Then it is told about valkalas, means different kinds of inner bark of trees. Then silk it is told there. Then certain kinds of leaves. Then thin sheets of silver, copper, etc. are also advised to be used for bandhana dravyas. That is the first reference. You can see in the sloka. In Kaushaya, Patra, Urna, Cheena, Patta, Charma, Antar, Valkala, Alabu, Shakala, Lata, with all different kinds of creepers. Such kind of things can be utilized as bandhana dravyas. That is the first sloka. That is bandhana dravya. Next, it is the types told. And when we see the types, according to Acharya Sushruta, there is 14 types. It is told Chaiti Chaturdasha Bandhana Vishesha. That is 14 types of bandhas are told by Acharya Sushruta. And according to Acharya Vakphata, it is 15. Along with the 14 types told by Sushruta, Utsangi is the 15th one added by Acharya Vakphata. And the sloka is Tatra Kosha Dama Swastika Anuvelita Mutoli or Pratoli Mandala Stakika Yamaka Khatva Cheena Vibandha Vidana Gofana Panjangi Cheti Chadurdasha Bandha Vishesha. These are the names of the 14 types of bandhas told by Acharya Sushruta. Next we will see means where and how the 14 types are used. This is the Kushta Anguyat Dama Sambadhayange Sandhi Kurchaka Bhrustanandara Talakarneshu Swastikam Anuvelitam Shakhasu Griva Metrayo Mutoli or Pratoli Pritte Ange Mandalam Angushta Anguli Metra Agreshu Stagigam Yamala Pranayor Yamakam Hanu Shanga Gandeshu Khatva Apangayo Chinam Prishta Udara Urasu Vibandham Murthani Vitanam Chibuka Nasa Aushta Amsa Bastishu Gofanam Jatruna Urtham Panjangi Miti Yova Yasmin Sharira Pradeshe Sunivishte Havadi Tam Tasmin Vidya. That is the quotation which is detailing about each type of bandha. So first it is this explanation is not in the order. So first we will tell about kosha. Tatra kosham angushta anguli parvasu vidadya. That is kosha is to be done. Kosha type of bandha is to be done in angushta anguli parva. So angushta anguli parva. Here it is in the commentary it is told parva shabdo angushta anguli bhi saha sambandhyate. That is angushta parva and anguli parva. In the fingers and in the amputated sides, this kosha bandage can be done. Kosha means pocket or purse. In the picture, you can see how it looks like a kosha bandha. That is the joint or in the fingers, in the thumb and the index finger mainly, it is told. So this kind of kosha bandha can be utilized for fingers and the site of amputation. Next it is swastika bandha. Swastika sandhi kurchaga bhrusthanantara talakarneshu swastika. Swastika can be taken as the figure of eight bandage or cross bandage, and it can be utilized in the axilla, chest, forehead, palms, ears, dislocation of shoulder, etc. Sandhi kurchaka bhrusthanantara talakarneshu swastika. These are the areas where swastika bandha can be utilized. Axilla, chest, forehead, palms, ears, dislocation of shoulder, etc. These kind of places swastika bandha is advised. Then next is Mutoli or Pratoli. Griva metrio, Mutoli or Pratoli. In the Griva, in the neck and the metra, that is penis. In these sites, Mutoli or Pratoli is the type of bandage which can be done. That is single or double strip of bandage, and the length of the cloth should be equal to the circumference of the organ. That is the type of Mutoli or Pratoli bandage, and it is used in neck and penis. Griva metrio, Mutoli. Next it is China. Apangayos China. Apanga unit, that is in the eyes or lateral aspect of the eyes. That is the apanga. And that side it is told we have to apply China Banda. China Banda, it can be taken as, it means a long cloth piece like a sari fall. This is a simple bandage to the eye where cloth ends are hooked to the ears. That is the China Banda. Next it is Dama. Dama Sambade Angi. That is in the regions like calf region, in the Gulfa region and all, this kind of bandage can be utilized. It is used in Gulfa and calf region. That is especially in Pindigo Dveshana, where patient get relief by pressure around his calf muscle. In that cases, Dama is the type of bandha advised, and it is also useful to prevent varicose veins, etc. Okay, that is in a cylindrical or in that shape sites it can be advised. Sambade Ange. Then next is Anuvelita. Anuvelitam Shakhasu. That is in the extremities, Anuvelita can be used. As a creeper encircle system, this bandage is done in spirals. That is Anuvelita in the Shakha region, in the extremities. Anuvelita is the type of bandha which is advised. Next is Mandala. Vritteyange Mandala. That is uh, in round surfaces or in a circular surfaces, we have to apply Mandala Bandha. Vritteyange Mandala. And when we take the site on large area of body like back, chest, abdomen, in such places, Mandala Bandha can be done. Next is Tagiga. Angushta Anguli Medra Agreshu Tagiga. That is at the tip of toes, fingers, penis. In these sites, Tagiga Bandha is advised. That is also similar to Kosha, but there Kosha is told in Parva. It is in the joint region, not at the tip. At the joint regions, it is told about application of Kosha Bandha. Here it is told like Agra. At the tip region of Angushta, Anguli and Medra, we will go for Tagiga Bandha. It can be taken as a supporting, means placed at the bone. Bandaging is done including the skin. In such cases, on tip of toes, fingers, penis, etc., this Tagiga Bandha is advised. Next is Khatwa. Hanu Shanga Gandeshu Khatwa. That is in the temporomandibular region, in the forehead region, in the cheeks. In such places, Khatwa is the type of bandha told. It can be taken as the four-tail bandage. It can be used in wounds of Hanu, Shanga, Kapala, etc. These are the places where Khatwa bandha is indicated. Next is Panjangi. Jatruna Urtham Panjangi. That is above the cervical region or above the neck region. Panjangi Banda is suggested. There can be 5 tails to the bandage cloth, and it will be covering the sides above the neck region. That is Panjangi. Next is Gofana. Chibuga Nasa Oshta Amsa Bastishu Gofana. That is in the uh, chin region, in the nose region, lips, then Amsa shoulder region, and Bastishu in uh, the suprapubic region. That is in the Basti means you can take it as the suprapubic region. In that places, this Gofana Banta is advised. We can take it as a scrotal bandage or T bandage is somewhat similar to the Gofana Banda. Next is Yamaka, Yamala Vranayor Yamaka. That is Yamala Vrana means double or twin. When there are two sides adjacent to one another, same bandage can be fashioned obliquely to cover both areas. No need of two bandages separately. If it is the sides are adjacent to one another, same bandage is fashioned obliquely to cover both the areas. That kind of banda is called Yamaka. Yamala Vranayor Yamaka. Yamala Vranayor means two, double. That is when there are two sides adjacent to one another, same bandage can cover both the areas, and that type of banda is called Yamaka. Next is Vibandha. Prishta Udara Urasu Vibandha. That is in the Udara, in the abdomen region, Prishta in the lower back region, and Uras, chest region, Vibandha can be done. It is many tailed, that can be taken as many tail bandage, means a quadrangular piece with small strips on its four corners. The central cloth will cover the site, and this tails will be used to uh, tie, means tied the bandage. That is, many tail bandage can be taken as this Vibandha. In the picture, you can see how the bandha is done. Many tail and a quadrangular piece will be there with small strips stitched on the four corners. The center part will cover the side, and the four means strips will be helping to tighten the bandage. That is Vibandha. It is can be used in sites like Prishta, Udara, and Uras. Next is Vitana. Murthani Vitana. That is in the scalp or the head bandage that can be taken as Vitana. It should be wide and expansive. That is Vitana. The word Vitana itself means something which is wide and expansive. So it is told Murthini Vidanam. It is indicated in scalp or in the head. So these are the 14 types of bandha told by Acharya Sushruta. So first is kosha, which is to be used in fingers and then sites of amputation. Then swastika bandha is can be compared to figure of eight or cross bandage, which can be used in sites like axilla, chest, forehead, palms, ears, etc. Then mutoli or pratoli, it can be used in neck and penis region. Next is china, it is indicated in sites like apanga. That is a simple bandage to the eye where the cloth ends are hooked to the ears. Next is dama in Sambadyangi, that is in regions like calf region, vulva, etc. This kind of bandaging can be done, especially in Vindigo Dveshana, where the patient will get relief in uh, the calf muscle to means by pressure, a relief will be obtained, and it is also useful to prevent varicose veins. Next is Anuvelita, and it is used in extremities. Then Mandala Vrityange, that is in the circular parts, especially back, chest, abdomen. These are the sites where Mandala Bandha is indicated. Then next is Tagiga. It is somewhat similar to Kosha, but in Kosha it is Anguli Parva tool. Here it is Agra, that is tip of toes, fingers, penis, etc. are the sites where Stagiga Bandha can be applied. And next is Khatwa in Hanushanga, such regions. Khatwa is told can be taken as a four-tailed bandage. Next is Panjangi. Panjangi from the name, you can take that five-tailed bandage. Means above the Jatru. In that size, Panjangi Banda is told. Next is Gofana. Gofana Banda. It is indicated in sites like Chibuga, Nasa, Ushta, Hamsa, Basti. In such sites, Gofana Banda is indicated. It can be taken as the T bandage or scrotal bandage. Next is Yamaka. Yamaka, Yamala Vranayor, Yamakam. Yamaka means double or twin. That is when there is two sides adjacent to one another. Same bandage can cover both the areas. Such type of banda is called Yamaka. Next is Vibanda, many tailed or a main or a center cloth will cover the site of injury, and to the center cloth there will be small strips attached to the four corners. That is the type of banda called Vibanda. It can be used in Udara, Prishta and Uras. Vidana, from the word itself, it means wide and expansive. It is a head bandage. It can be used in the smoothing. So these are the 14 types. Next, it is told about the Bandha Niyantrana. That is how to keep the bandha in position. And based on that, three places are told where this yantrana can be done: above, below, and sides. Yantranam Urthamada Sityaksha means uh, yantrana in the commentary it is told Patta Granther Bandhan, the site where the tying have to be done, where the knot have to be put, or where the bandage have to be tightened. Means the end, how it should be, how the knot or how the means where it should be tightened, or we are putting the knot where the knot should be. If we are applying that stick plaster or pins, where it should be. That is the bandha niyantrana or yantrana. The shloka is yantranam urdham adha stityaksha. Three places are told for yantrana: urdha above, adha below, and in the sides. Yantrana in the community is told patta grant. That is about yantrana. Next it is the Trivida Bandha tool. So based Vrana Ayata, the three types are told. Tatra Vrana Ayatana Vishesha, Bandha Vishesha, Trivido Bhavati. Location of the wound, bandaging are of three kinds. That is told Gadha, Sama and Shitila. Next it is told how we can understand that which is Gadha, which is Sama and which is Shitila. For that, the explanation given is Pidayan Arujo Gadha, Sa Uchvasa Shitila Smita, Naiva Gadho na Shitila Samobanta Prakirtida. So, Pidayan Arujo Gadha. That is, Pidayan means it will be tight, but Aruja, it will not cause pain. That is the criteria for Gadha Bandha. That is, it will give a tightness or it will give a pressure, but it should not cause pain. Pidayan Arujo Gadha. That is the criteria for Gadha Bandha. Next is Sauchvasa Shitila Smita. Sauchvasa means Anavagada. It will not be that much tight. That is Shitila. Somewhat loose we can tell. That is Sauchvasa Shitila Smita. Means that much pressure it will not exert. It will not be that Gadha. Anavagada. That is Shitila. Naiva Gadho na Shitila. Samobandha Prakirtida. And Samabandha is the type of bandage where it is not tight nor loose. Na Gadha, na Shidila. That is the third type, Sama. We can take it as a moderate tightness, where it is not that tight, not too loose. Gadha also it is not like, especially it is told like Aruja. The Gadha Bandha should not be so much tight that it should create pain. It is not like that. It should give an appropriate pressure or tightness. Shidila means it will not be, it is somewhat loose. So Uchvasa means there will be a space in between. That much pressure it will not be applied. Third one is in between. It will not be that much Gada, it will not be that much Shidila also. That is the third type, Sama. So these are the three kinds of bandaging depending on the location of wound. That is the explanation told. Tatra Varana Ayatana Visheshat Bandha Vishesha Trivido Bhavati Gadha Sama Shitila iti Pidayan Arujo Gadha Sa Uchvasa Shitila Smita Neva Gadho Na Shitila Samo Bandha Prakirtida. Next it is told where means the site where these kind of bandhas have to be applied. First of all, we have told that is depending on the location, this classification is given. So first the names are given. Next it is told how the uh, bandha will be, and third it is told about the location. In which location, which kind of bandha have to be applied. It is told tatra spit kukshi aksha vankshana uru shirasu gadha. Spic in the gluteal region or the buttocks region, kukshi in the abdomen region, kaksha axillary region, vankshana in the groin, and in the shiras. These sides we have to do Gada Bandha. Spik, Kukshi, Kaksha, Vankshana, Uru, Shirasu. These are the places where Gada Bandha have to be applied. Then Shakha, Vadana, Karna, Kandha, Medra, Mushka, Prishta, Parsha, Udara, Urasu, Sama. Which are the places where Samabandha have to be done. Shakha in the extremities, Vadana in the mouth region, Karna ears, Kanda throat, Medra in the penis region, Mushka in the scrotal region, Prishta in the back low back region, then Parsha in the sides, Udara in the abdomen region, Urasu in the chest region also. We have to do Samabandha. That is about Samabandha. Next is Akshno Sandishucha Chithilaiti, where we have to do Shidila Bandha, that is loose bandage on eyes. Akshno Sandishu, and in the joints, because joints there should be some kind of mobility. Means joints, of course, we know, means joints are the places where there are, in some joints there are removable joints, but still most of the joints are movable. So in such kind of joints there should be a range of mobility which should be permitted. So in eyes, akshno sandishu, and in the sandis, in the joints, we have to apply shidila bandha. So to facilitate actually, it is, we cannot do tight bandaging because of the in structure. As such, we should not go for tight bandaging, and joints to permit some kind of mobility, we have to go for shidila bandha. That is the location. Different locations where these kind of gadha, sama, and shidila bandha have to be applied. Next, it is depending on the doshas. Tatra paitikam gadasthane samam badniyat. Some exceptions are told. Tatra paitikam gadasthane samam badniyat. Samasthane shidilam. Shidilastane neva. एवं शोणित दुष्टं च श्लैष्मिकं शिथिलस्थाने समं समस्थाने गाढं गाढस्थाने गाढधरम् एवं वाददुष्टं च. So based on the doshas, how it should be, that is tatra paitigam, in conditions where pitta visheshan dosha visheshat bandha vishesham nirdishtamaha. So on the basis of the visheshan of doshas, how the bandha should be. Tatra paitigam gadasthane samam badniyat. In case of pitta vitiated conditions and in case of rakta vitiated conditions, gadasthane samam badniyat, where usually gada bandha is suggested, there sama bandha should be done, should not be tight. Then samasthane shidilam, where samabandha is indicated, in such sites when there is pitta visheshan, we have to do shidila bandha. Shidilastane neva, and where shidila bandha is suggested, or whether we have to, when supposed to naiva, we should not do bandhana only. That is the case of pitta and rakta dushta conditions. Of course, we know, means in that conditions, maybe because of the pakavastha which can be happening due to already vitiated pitta and rakta is present. So if we are doing bandha, sometimes there can be aggravation of the condition and it can cause complications like separation and all. So तत्र पैत्तिकं गाढस्थाने सममत्नीयात् समस्थाने शिथिलं शिथिलस्थाने नैव एवं शोणितदुष्टं च. That is in pitta and rakta vitiated conditions, where we are supposed to do gada bandha, we have to go for samabandha. Then where we have supposed to do samabandha, we have to go for shidila bandha. And in places where shidila bandha have to be done, we should not do bandha only. That is told. Next is Shaishmikam Shitilastane Samam Samastane Gadham Gadasthane Gadadaram Evam Vatadushtam cha. And in case of Shlaishmika, in Shleshma and Vata Dushti conditions. Shidilastane Sama. That is the opposite. Where we have to go for Shidila Bandha, we have to do Sama Bandha. In Sama uh, Bandha conditions, or where Sama Bandha have to be done, we have to do Gadha. And Gadha Stane Gadadara. Means in where we have to go for Gada Bandha, it should be Gadadara. Much tightness is told. That is told about Shleshmika and Vadadushta conditions. So, Shleshmikam Shithilastane Samam, Samastane Gadam, Gadastane Gadadaram, Evam Vadadushtam cha. Whatever it's told for Pittaja and Raktaja condition, the opposite is told here for Kapha and Vataja conditions. That is based on the Dosha Visheshan. Dosha Visheshat Bandha Vishesham Nirtishtamaha. Next is Tatra Paitikam Sharadi Grishme Dviranno Batniyat Raktobadrudam Apyevam Shaishmikam Hemanta Vasandayo Trahat Vata Ubadrudam Apyevam. That is how the bandaging should be. Means what is the frequency of changing bandaging, or how often we have to do the rebandaging. That is told here. Tatra Paitigam Sharadi Grishme Dviranno Batniyat. In Pittaja conditions, in Sharat and Grishma Ritu, bandaging should be done once in 2 days. In Raktaja condition also, same as the rule. Shaishmigam Hemanta Vasantayo Trehat. In Shleshma and Vatadushta condition, and Hemanta and Vasanta Ritu, once in 3 days, the rebandaging should be done. That is the frequency of changing, or based on the Kala, how the bandaging should be. That is told here. Tatra Paitigam Sharadi Grishme Dviranno Batniya Traktobadradam Abyevam Shleshmikam Hemanta Vasantayo Jahat Vatobadradam Abyevam. Next, it is the indications. Churnidam Madidam Bhaknam Vislishtam Adipaditam Asti Snayu Sirachinnam Ashubandhena Rohati Sukhamevam Pranishede Sukham Gachadi Dishtadi Sukham Shayasanastasya Kshipram Samrohati Prana. That is in Bhaknas, like Churnita, Madhita, means in the commentary it is told Churnitam, Bahuda, Khandi Kritam, Madhidam, Vilodidam, Bhaknam, Kanda Bhaknam, Vislishtam, Sandhichudam, Atipadidam, Sthanachudam, Avalambamanam. Chinna Shabdo Astyadibihi Pratyegam Sambadhyade Churnitadishu Gamana Agamana Sthana Shaineshu Api Chadurshu Bandha Prashasta Ityaha Sukhamityadi Chete Swapiti Tishtadi Uthibhuta Aste Shayasanastasya Sukham Bhavati Ityaha. That is, in which all conditions we have to go for bandhana. Churnidam means, in the commentary it is told, Churnidam Khandikridam. You have already learnt about Churnida type of fractures. That is, there will be crushed injuries, crushed and that kinds of injuries. And Madhidam it is told Vilodidam, lacerated wounds, etc. Bhakna is fracture only. Then Vislishtam Adipadidam, dislocation of joints. So, Asti Snayu Sirachinna means in any kind of injuries like Asti Snayu, Asti Chinna, Snayu Chinna, Sirachinna, means any of the conditions also, Ashubandhena Rohadi. That is, easily there will be healing. In these conditions, if we apply bandhana, then the healing will be quick. Churnitam, Madhidam, Bhaknam, Vislishtam, Adipaditam, Asti Snayu Sirachinnam, Ashurabandhena Rohati. So these can be taken as the indication. Next it is told like Sukham evam pranishede, Sukham gachadi tishtadi, Sukham shayasanastasya, Kshipram samrohati prana. That is, there will be relief from pain, the person will be able to sit, walk and stand easily. And Sukham shayasanastasya, Kshipram samrohati prana. And there will be, the prana also will heal quickly in when bandhana is done in a proper manner. That is the indication. The first two lines are the specific indication in which all conditions bandhana can be done. Next, it is the contraindications. अबन्ध्या पित्तरक्त अभिघात विषनिमित्ता यदा शोफदाहपागरागतोदवेदनाभिभूता क्षाराग्निदग्धा पाकात् प्रकुदित प्रशीर्ण मांसाश्च. When the wounds are or the condition is where there is pitta and rakta vishesha, pitta rakta abhigada visha, pitta rakta abhigada visha nimitta, and when there is an injury or a condition which is caused due to abhigada and visha. In all these four cases, this bandha is contraindicated. Pitta, rakta, abhigada and visha nimitta. In these four, if the cause is due to, means if the condition or the injury is caused due to pitta, rakta, abhigada, visha, because of these reasons, in that wounds bandha is contraindicated. And then yada shofa daha paga raga toda vedana abhibhuda, means when the condition is accompanied with these features like shofa, edema, burning sensation, pus formation, redness. In that condition also, uh, bandhana is contraindicated. Kshara Agni Dagda Pakat Prakudita Prashirna Mamsasha. When the wound is caused by Kshara Agni, etc., then also Bandhana is contraindicated. And Pakat Prakudita Prashirna Mamsasha means when the mamsa or the muscles are decomposed and it is falling off. In that condition also, the Bandhana is contraindicated. Next is Kushtinam Agnidagdanam Pedagamadumīhinam Karnikascha Unduru Vishe Vishajushtashaya Vrana Mamsapakena Badhyante Budapakecha Darune Swabudhyachapi Vibajet Kritya Krityascha Buddhima. Same only it is told, that is in conditions of kushta, different kinds of kushta. Then Kushtinam Agnidagdana. Already it is told Kshara Agnidagda is already told contraindicated. Then Pedaga Madumehinam in case of Prameha Pedagas. Karnikascha Unduru Vishe, then Vishanimitta means Vishajustashe. In different kinds of Vishas also. Visha afflicted conditions also Bandha is contraindicated. Then Mamsapakena Badhyante Budapakecha Darune. All it is also told already, that is when the condition is because of the Paka there is Pragudida Prashirna Mamsa, that conditions are also contraindicated for Bandhana. And it is told Swabudhyachavi Vibhajit means according to the condition or according to the yukti, we have to go for further treatment in such cases. Next, it is told about the Bandha Guna. Aviparita Bandhe Vedanopashantir Asak Prasado Mardavamcha. That is, when it is properly done. Aviparita Bandhe. When after seeing the conditions properly and if it is suitable for other factors are suitable, when it is properly done, then the bandhana gunas are told like Vedana Upashanti. There will be relief from pain. Then Asra Prasado. There will be that Rakta Prasada. Means there the circulation can be taken as the circulation. The circulation will be proper and there will be Rakta Prasada. Mardavamcha. The stiffness and all will be relieved. So these are the bandhana gunas. Aviparida bandhe vedanopashanti asra prasado mardavamcha. These are the gunas told for bandhana if it is done properly. That is about bandhana, just told in Sushruta Samhita. Next it is about the modern aspect of bandhana, bandaging. So bandages, it is a piece of gauze or any other material applied to the limb or any affected part as a dressing. And about the uses, means bandaging, where and all it is used. It is used to stop bleeding by pressure. It is used to give rest and support to the affected part. Means especially in case of injuries and all, to give rest and support to the affected part, then bandaging is done. Then to immobilize a part as in fracture and dislocation. We know, we have already discussed about that. In fracture and dislocation also, for immobilization, main method told is bandaging only. Then to retain dressing and splints in position, especially in case of wound management, the bandaging is done to keep that dressing or medicines or whatever application is done to retain that dressing, the or the splint which is kept inside. For that, bandaging is done. and to correct in the deformity. If there is any kind of deformity present, then for tightening and all, to keep the thing, dislocated or uh, the structure in normal anatomical position, we have to go for bandage. So these are the uses as such. And materials used: cotton bandages are used, muslin bandages are used. These are the different kinds of materials used. Next is about the types: roller bandage, triangular bandage, T bandage, four tail bandage. These are the different kinds of bandages told. First is the roller bandage. Roller bandage, it is commonly used. Uh, that is the roller bandage. We will unroll the bandage to wind around the affected part. It will be having a head end and a tail end. And in sometimes the tail of the two bandages are stitched together also. That is roller bandage, which is commonly used. Next is the triangular bandages. That is a diagonally folded piece of cotton cloth. Especially it is used for slinging of the forearms. That is triangular bandages. Next it is T bandages. Mm, Consists of a horizontal limb and a vertical limb that looks like a T. Mainly it is used after operations on perineum and anal canal. Earlier we have told about the scrotal bandage. So same thing only, T bandage. Gofana Bandha, when we told, we have told about T bandage. Same thing only. It will be having a horizontal limb and a vertical limb, and altogether it looks like a T. Mainly it is used after operations on perineum and anal canal. Next it is four-tailed bandages. That is ends of the bandage are longitudinally split to make four tails. In the figure you can see. It is used in fracture of lower jaw. Such kind of bandages are mainly used in fracture of lower jaw. Other means in knee joint also it can be utilized. According to the need, according to the site, we can use the four tail bandages. In the four tail bandage, the two ends of the bandage are longitudinally split to make four tails. And next is the rules of bandage. So first thing is the correct size. Into the area means according to the area covered, the correct size have to be maintained. Means it should be selected according to the site. That is, we have to select a bandage of proper size and suitable material also. Then patient should be means the patient for whom the bandage have to be applied, that patient had to be placed in a comfortable position. And if there is any injured part, other than that, if there is any injured part, so while bandaging also we have to support the injured area. Bandaging is done to support the area, but still during bandaging also proper care should be done to support the injured area. And if a joint is involved, then we have to flex it slightly. As I have told earlier, um, means joint means there should be a minimal mobility needed. So for that, little flexion, otherwise it can cause complications. So uh, if a joint is involved, flex that joints little slightly, and then bandaging have to be done. uh, when we are doing the bandage, better we have to face the patient while applying the bandage, except when we apply bandage to the head. Other than that, better we have to face the patient. In such a position we have to do the bandaging. And about the holding the roll, means we have to hold the roll of the bandage in the right hand when applying bandage in the left side. And better hold the bandage with the roll uppermost and apply the outer surface of the skin, unrolling a few centimeter of this bandage at a time. That is the best method of holding the roll of bandage. Right hand when applying the left side, and hold the bandage with the roll uppermost. Then better we have to put some cotton wool on the part to be bandaged, so that the bandage does not slip or cause any kind of injury or cutting into the skin underneath. So for that we can put some cotton wool first, then we can do the bandaging. And bandage should be done from below upward and from within outward. How means the position it is told from below upward and from within outward. That should be the movement, how the bandaging movement should be. Then hold the end of the bandage over the outer aspect of injured area and wind the bandage around the part twice to fix it. First of all, while doing the bandage, at the site we have to do the means wind the bandage twice. That is for fixing the bandage. Then only we will move upward. Where we are starting, that area we will do the winding twice to fix it. And when bandaging a limb, we will start with an oblique turn to keep the bandage in position. That is an alternative method. In case of limbs, oblique turn also can be done. And while bandaging, means first when we have applied a wind, means first roll is done, cover 2/3 of the bandage by the next one. That should be the measurement. Means one rotation is over, and then while we move on to the next one, the first one, the 2/3 of the bandage should be covered with the next roll. That should be the position. That is especially while covering a large area by binding the roller bandage around the part. In such cases, 2/3 of the bandage should be covered by the next one. And the edges should be parallel. That is the method. Then how the tightness should be. Keep even and not too tight pressure. Means while applying bandage, as we have told, it should not be too tight, it should not be too loose. Means if it is too tight, uh, it will interfere the circulation. And if it is not too, means if it is too loose, it will not serve the purpose. So always the bandaging should be applied in such a way that it is not too tight, not too loose. And all means while finishing, finish with a straight turn so that we can fix the end with the safety pin. It should not be oblique or something. We should fix the end part or finish with the straight turn only. And there we can use safety pin or sticking plaster, or we can divide the terminal portions into two longitudinally and we can tie it. So any ways we can finish the bandaging. And in case of finger, toe, etc., we have to leave the means if it is not to be covered, only means everything the rules it is according to the condition. So if the tip is not, means if we don't want to include the toe means tips, we have to leave the fingers and toes exposed. That is for checking the circulation. So we can see, we can make out that whether the bandage is too tight, or means if there is any complication we can see, means if there is any interference in circulation and all, we can make it out by observing the fingers and toes. For that we have to leave the fingers and toes exposed. And especially the extremities, in case of other sites also, extremities have to be observed carefully. That is for any kind of signs of swelling, blueness, etc. And when removing bandage also, it should be uh, means one hand to other, it should be passed so that it can be taken in a concentric fashion. So while removing, that is better. From one hand it should be passed to the other hand while removing. These are the main rules of bandaging. So once again, first is we have to select the bandage of proper size and suitable material. Then patient should be made to lie or sit in a comfortable position. Then while bandaging itself, we have to support the injured area. That should means the wound should be, or the injured area should be taken care properly while bandaging. We should not be careless. Then in case if a joint is involved, slightly flex the area to facilitate the slight movements. And better we have to face the patient while applying the bandage, except when applying it to the head region. Then holding the bandage, in case of applying bandage to the left side, better to hold the roll of bandage in the right hand. Then before bandaging, before directly applying the bandage material, we can put some cotton wool on the part to be bandaged so that the bandage does not slip, or it will not cause any cutting or bruise over the skin. skin. Next, the movement, how it should be. It should be below upward, from below upward, and from within outward. That should be the bandaging way. Then hold the end of the bandage over the outer aspect of the injured area and wind the bandage around the part twice. To fix the bandage twice, we have to wind the bandage. And when bandaging a limb, an alternative method is also told, that we can start with an oblique turn to keep the bandage in position. And about the winding, that is, when we are bandaging or when we are covering a larger area by winding the roller bandage around the part, in such cases, cover 2/3 of the bandage by the next one. In such a manner, the bandaging should be done and the edges should be parallel. And next, the tightness. It should not be too tight, it should not be too loose. If it is too tight, it will interfere the patient. And while finishing, finish with a straight turn, and at that point fix the end with safety pin, sticking plaster, or we can make the knot also. And after, means every time, better to expose the finger and toes to check the circulation, and extremities can be observed to see the signs like swelling, blueness, cyanosis, anything is there. For that, extremities also have to be observed carefully. And while removing bandage, pass it from one hand to other so that it can be taken back in a concentric fashion. That also is told as a rule of bandaging. Then next it is told about the turns of bandaging. That is circular, spiral, reverse spiral, recurrent, etc. It is told. This is the circular turn. In a circular manner, the turn or the winding is done. Next it is spiral. Spiral, this type of bandage is used for uniform thickness part. That is wrist, finger, etc. This kind of bandage is used. Each turn of the bandage overlaps the previous turn. You can see in the image. Each turn of the bandage overlaps the previous turn. Next is reverse spiral. This bandage is used for the parts where the thickness varies. Legs, forearm, etc. It is applied in the same way as the general spiral bandage, but each turn is reversed as necessary to prevent gapping and to make the bandage smooth. So that is reverse spiral. This is the circular turn. This is the spiral and reverse spiral. Next it is recurrent. Recurrent means it is usually used to cover the amputation stump or tip of the finger. Means the bandage is laid over repeatedly by forward and backward turns. There is no upward movement. Means at a place it is means repeatedly the bandaging is done. That is a recurrent turn. That is the another one. Next it is the figure of 8. This bandage is used for elbow, knee joints, etc. This bandage is made by forming two loops or oblique turns over a joint. The turns alternatively ascend and descend to cover the part. That is what is done in figure of 8. You can see, means upward and cross, then down and cross. In that manner, it is the bandaging is done. That is figure of 8. That is, turns are alternatively ascend and descend to cover the part. First, if we are applying, means first every time we will fix the bandage with the twice winding, then we will move up, then cross, then down, cross. So in alternate manner, the bandaging is done in figure of 8. In the picture also you can make it out how the winding is done. Mainly it is used for elbow and knee joints. Next it is the special bandages like cape-line bandages. Cape-line bandage, this is cape-line bandage where tails of two bandages are stitched together. Joint portion is applied on the forehead. Both wound around the head. One passing backward and forward over the head while the other travel horizontally around the head. So this is the cape-line bandage. Tails of two bandages will be stitched together. Joint portion. is applied on the forehead. You can see the joint portion there. And both, we have told, tails of two bandages are there. So both the uh, tails will be wound around the head. One passing backward and forward over the head, and while other will be horizontally around the head. That is the cape line bandage. This is a special kind of bandage. Next is abdomen bandage, where a single wide or several narrow ones. In the description of bandha, we have seen in several narrow ones wound around the abdomen on moderate pressure. That is the abdomen bandage. Next is ankle bandage. One loop around the sole and other around the ankle. In that way, ankle bandage is done. This is axilla bandage. We have seen in the bandha, that portion we have seen about the axilla bandage. Next is butterfly bandage. That is adhesive bandages used in place of sutures to hold the wound edges together. That is called butterfly bandage. In mainly it is used in the suture areas to hold the wound edges together. This adhesive bandages will be applied. That is butterfly bandage. Next, it is about the fastening of bandage. Means how to fix the bandages after the last turn. I have already told about we can use safety pin, or we can use the plasters, or we can split the tail of bandage, and at the bottom of the split we can tie, we can make a knot, and by uh, passing it to the opposite direction and surrounding the part, it can be tied together. So either by knot, or by safety pins, or by other pins will be there, or plasters. In either of the ways, we can fasten the bandage. That is, we can fix the bandage after the last turn. These are the different points regarding the modern aspect of bandha, bandaging. Next, it is about the diagnostic techniques. So first is X-ray. So William Roentgen is the one who have given the, or one who have uh, found about the X-rays. So what are X-rays? Weightless bundles of energy without an electrical charge that travel in waves with a specific frequency at the speed of light. That is what are X-rays. X-ray photons interact with the materials, they penetrate and cause ionization. And the technology which is used in this X-ray technique is X-ray diffraction. Is the technique where X-ray light changes its direction by amounts that depend on the X-ray energy. Like a prism, where when light is passed into a prism, it will separate the light into its component colors. So similarly, the X-ray light will change its direction according to the X-ray energy which we are giving. It will be uh, means spread, or it will be separated. So X-ray diffraction is the technique which is used in X-ray, uh, means the procedure in the diagnostic technique of X-ray. That is the technology used, X-ray diffraction. And how the procedure is, means a procedure of taking X-rays. So an X-ray is a photo taken, that is a photo taken with a machine which passes electromagnetic radiation through the body and capturing an image of the internal structures. So in this procedure, the patient will be asked to remove the clothing and jewelry, and he or she will be asked to wear a gown given. Then the patient is positioned on an X-ray table that carefully positions the part of the body that is to be X-rayed. Means depending on the uh, suggestion only, we will expose the X-rays or expose the patient to the X-rays. So according to that, the patient should be positioned. So which part of the body, or means which of, part of the body uh, means is to be investigated, based on that the patient is positioned. that the part of the body that is to be x-rayed between the x-ray machine and a cassette containing the x-ray film. And whatever necessary examination is done, that also can be done prior to that. And the body parts not being imaged, that should be covered with a lead apron to avoid exposure to the x-ray exposure is dangerous. So wherever the exposure is not needed, that part should be covered. The x-ray beam is then focused on the area to be photographed, and the patient must be very still or the image will be blurred. Means for exact means image to be obtained, the patient should remain still. Okay, and the step behind the protective window and the images taken. And sometimes various x-rays may have to be taken at different angles according to the means investigation slip, like in chest x-ray, front and side views needed. In some cases of fractures and all, different positions are suggested. So based on that, we have to take the images. Next is about the steps of processing: developing, fixing, washing, and drying. Developing means the formation of image. Fixing, stopping of development or permanent fixing of image. Means it will be altered. We have to get the clear picture. So that is fixing. Where means the image on the film should be fixed. And then washing. Residual fixture if it is needed, that is removed. Then next is the drying procedure. That is warm air blowing over the film. So these are the 4 steps of processing: developing, fixing, washing, and drying. Indications, in fractures, bone structures, foreign body localizations, chest x-rays means for lung disorders, heart disorders, bowel obstruction. So these are the different uh, conditions where x-ray can be done, especially in bone structure. And nowadays, mainly for fracture, bone structure, chest x-rays, these are widely used. And contraindications, pregnancy in children also, it is uh, means the condition is means the procedure is contraindicated because of the complications that can be caused due to the radiation or exposure. These are contraindicated in pregnancy, in the patients having mental illness, and the people of or the children, means in the child group, x-ray is contraindicated. Then how the different tissues in body will absorb x-rays at different extents, and how it will be mm, visualized in an x-ray, how the sites will be. In case of bone, there will be high absorption of the x-rays and it will appear white. Then in tissues, it is somewhat in the middle, so it will be appearing gray. And air, it is having the low absorption and it will appear black. That is the absorption, or how, what is the extent of different tissues of how they absorb the x-rays. Bone will be white because of its high absorption. Tissues will be gray because of its mediate absorption. Air will be black because of the low absorption. Next, it is advantages. So advantages, when we take x-ray, is considered the cheapest, the most convenient and widely used method. X-rays are not absorbed very much by air, so the specimen need not be in an evacuated chamber. The method and all, it is somewhat more easy. Means when we it is like when we compare to other techniques like MRI, CT and all, that much chambers and all, it is not needed for X-ray. And identification of fracture, other suspected bone pathology, that is also very quick. It can produce fast images. So these are the advantages. And disadvantages, when we see, they do not interact very strongly with lighter elements. Some pathologies we cannot make it out by an x-ray alone, so that is a disadvantage, because for lighter elements it will not interact properly. uh, and of course a fracture might not be evident on one view, so we have to go for different kinds of positions. So that is also a disadvantage. Then high doses of radiation. Many kinds of abnormalities or complications are produced due to the exposure to these kind of radiations. So that is also a disadvantage. And detailing, that is in tissue detailing and all, when we compare it with other techniques, it is very poor in tissue details. That much clear image or clear uh, details we will not obtain from an x-ray. So that is about x-ray. Next is MRI. So MRI, magnetic resonance imaging, that is a spectroscopic imaging technique. It will help in producing images of the inside of human body, and it is based on the principles of NMR. NMR means nuclear magnetic resonance. That is the principle of MRI, magnetic nuclear magnetic resonance, NMR. So it is based on the principles of that nuclear magnetic resonance, and it is used to obtain microscopic chemical and physical data about molecules. So that is the main principle. As I have told, it is NMR, which is the principle involved in MRI. It started out as a tomographic imaging technique, that it produced an image of NMR signal in a thin slice through the human body. That is the principle. And the physics behind MRI is magnetism and resonance. Then the indications, mainly elements of brain like tumors, hemorrhage, such kind of conditions. MRI can be done. In sports injuries also, it is indicated. Then musculoskeletal problems, spinal conditions or injuries, any vascular abnormalities, female pelvic problems, prostate problems, any other GIT conditions, ENT conditions. In such kind of conditions also, MRI is suggested, because better than X-ray, there will be a detailing of the structures which can be obtained through MRI. So in different kinds of conditions, this MRI can be suggested as a major investigation procedure. And about the contraindications, as told for X-ray, pregnant women, and in patients who are having pacemaker or in cochlear implant, as it is already indicated in conditions of means ENT conditions, it can be used. So in patients who are having cochlear implant, they should not be uh, advised with MRI investigation. And also, if a person is having any kind of metallic implants or metallic foreign body, that is also a contraindicated condition. Means the in findings, different kinds of organs, bones, joints, tissues, brain, spinal cord, heart, nerves, blood vessels, breast, all these can be investigated with the help of MRI. And advantage is that ionizing radiation is not there, variable thickness in any place, and it can be done without any contrast. In X-ray also, for detailing and all, barium meal, etc., I mean such contrast have to be used for a detailed image. So here, uh, without an IV contrast also, many details can be obtained. So that is considered as an advantage over X-ray. And about the disadvantage, when we see, it is very expensive, and it's dangerous also. As in news and all, you might have seen certain conditions means where it is very much dangerous that if at all, in by chance, if there is a metallic device placed and all, that will end up in a even death. So that much dangerous it will be, the mechanism, or if proper care is not taken, that can end up in a severe dangerous conditions. Similarly, when there is slight movement, it will cause blurred images. During scanning, if movements, any kind of movement is done by the patient, that can cause blurry images. Then in claustrophobic patients, it will be difficult to perform. And if the RF transmitter is mishandled, then there can be severe burns also. So in that manner, about the handling and all, it is very difficult to, it is not an easy handling technique. So it is considered as a dangerous procedure if proper care is not taken. It is not told like it is dangerous all the time, but in case by mistake, if any kind of careless things are happening, it can be dangerous to the patient and other persons also. So the handling and the expense is considered as the main disadvantages of MRI. And types of MRI, it is of three, means based on the structure of the MRI machine. Three types of MRI machine are there based on the structure: closed, open, and upright. This is a closed MRI machine. This is an open MRI. This one is an upright MRI. So these are the three types of uh, MRI machines based on the structure. So that is about MRI. So MRI is magnetic resonance imaging. The principle of MRI is nuclear magnetic NMR, nuclear magnetic imaging. Then father of MRI is Raymond Vahan Damadi. So these are the just important points we have to see about the advantages and disadvantages. The advantages and disadvantages, it is mainly told over X-ray only. It's compared to X-ray, how it will be useful, how it will be advantages. So that is told here. So when we see a recap of MRI, these are the points to be remembered. Main thing, don't mistake in the definite means in the full form. Magnetic resonance imaging it is, then NMI or NMR it is nuclear magnetic imaging or nuclear magnetic resonance, that is the principle. And the physics behind MRI is magnetism and resonance. Indications and contraindications, when we see contraindication is almost same, means pregnant women who is having metallic implants and all such patients are contraindicated. Indications, most of the conditions MRI can be suggested as more detailing is obtained from MRI images. So almost many kinds of brain ailments, sports injuries, musculoskeletal problems, many kind of diseases we can suggest MRI. Advantages, as I have told, it is over X-ray. It is mainly told regarding there is no ionizing radiations, the no use of IV contrast. So such kind of advantages are there. And in disadvantages, mainly it is very expensive, and the handling, it is should be more careful. So if the handling is not proper, it can be dangerous. And we have seen the different types also. That is about a recap of MRI. Next is CT scan. CT scan, CT, it is computer tomography. Uh, Earlier, it is known as CAT, computed axial tomography. It is a medical imaging method employing tomography that is used to generate a 3D image of of the internal of an object from a large series of 2D images taken around a single axis of rotation. That is the principle used. And when we see the basic principle, CT scanners use the X-rays to produce the sectional or slice image, uh, as in conventional tomography. But radiologist film is replaced by sensitive detectors. That is the uh, what difference. X-rays are used to produce the image, but the film is replaced by sensitive detectors. So the detectors measures the intensity of the X-ray beam emerging from the patient and convert this to digital data. This data is stored and it can be manipulated by a computer. That is what is happening in CT. Then what happens? This information, whatever it is obtained, it will be a numerical information, and then it is converted into a grayscale representing different tissue densities, thus allowing a visual image to be generated. That is a CT scan. So CT scanners use X-ray. You can see the X-ray source. X-ray is what is used for the production of image, but the X-rays, first it is used to produce the sectional or slice image, but the radiologist film, it is replaced by sensitive detectors. And These detectors will measure the intensity of the X-ray beam that is emerging from the patient, and it will converted to digital data. And this data is stored and it is manipulated by a computer, and this information, which is numerical, that is converted to grayscale, and then the different tissue densities is represented accordingly, and finally a visual image is generated. That is the basic principle in CT scan. About the indication, of course, intracranial disease, malignancy of jaw, infection, post radiation, salivary gland, foreign body. In such conditions or in such structures, CT is advised. This is a CT of brain. First, it is a normal CT. Then next, it is there is hemorrhage. That white patches, that thick white which is surrounding, that is hemorrhage is present. We can compare the both structures. Then you can see the difference. The thick white line mark is the hemorrhage. Then this is the malignancy of jaw. So here in the CT image, that malignancy can be noted. So these are different CTs, CT of brain and malignancy of jaws. Next, about the advantage, as told, it is cross-sectional imaging, superior contrast and resolution, the geometric accuracy. The principle when we have described the accuracy is how whatever procedure it is going through, that indicates the accuracy. Then images can be manipulated. Axial tomographic section are obtained. So these are the advantages. The advantages of CT scan. And disadvantage, as told earlier, it is expensive. Facilities are not widely available. The slices will be very thin, contiguous or overlapping slices, found in high close of radiation. There also radiation exposure is there, and in sometimes there can be geometric miss also. So that is the disadvantages, and it is contraindicated in patients who are allergic to iodine, in children below 2 years of age, in pregnant women, in old age people who are over 60 years of age, patients with hypertension. In such conditions, it is contraindicated. When we compare the three, that is X-ray, MRI, and CT, X-ray will create 2D images, CT 3D images, MRI 4D images. X-ray, it is used primarily to see the bones, especially it is not only for bones, but primarily to see the bones and to detect cancers, chest X-ray for pneumonia, etc. And when we go for CT scan, it is used primarily to diagnose condition in organs and soft tissues. And MRI used primarily to scan the spine, brain, breast, muscles, abdomen, and neck. X-ray is the most common and widely available, as already told. And when we consider CT and MRI, it is more expensive, and it is when CT is considered, it is widely used, but MRI it is less used. When we compare the expense, it is more in case of MRI. X-ray uses radiation to produce images. CT also use ionization radiation to take the image, and MRI it is using powerful magnet and radio waves to create the images. That is the main difference between X-ray, MRI, and CT scan. When we compare the three, these are the major differences. Next, it is USG, ultrasonography. It is a non-invasive procedure for visualizing soft tissue structures of the body. Here we will record the reflection of high frequency sound waves. The main technique it is used is the high frequency sound waves directed into the tissues. That is the main principle. And this is the USD machine. It consists of a monitor, transducer, keyboard, drive,